So working with someone that had hip and back pain, had them do 3 things: massage these abdominal muscles. So in this case, it was like this psoas area, this iliacus area that's kind of like hugging inside your hip bone, and then this QL area through the side. We use this stick to help them. So from here, they would just use the wall, push into that wall, see any soreness there, come down, kind of find that hip bone and wedge the stick through there, and then come on the side and work on that QL muscle, the side abdominal muscle there. So once those muscles relaxed a little bit, they felt much better. I had them go through some bracing. So in this case here, this nice strong exhale, pressing downward into the stick. Have them feel that pressure through their stomach. And the last thing was teaching them how to expand their abdominal area and kind of feel this abdominal pressure. So I kind of had them think about their stomach as a balloon, and when they would breathe in, that balloon would expand. And I used the back brace just to help them kind of feel that, that resistance, that pressure. So in this case here, when that balloon would expand, it would push into the belt. So they would get that brace. They would expand and push laterally outward, or just expand and push into this belt as much as they could. They felt that pressure in there. They would hold that position for a few seconds, relax. And that was it. Once they did those 3 things, it was much better for them. They had no more pain. So I hope that helps you. If you have any questions, let me know.